Anthony, I believe you've said that healthcare should be a right, and the Progressive Party favors enacting statewide healthcare system for all Vermonters also. How would you pay for this? Would you prefer to have totally tax-based system, as in Canada, or would you favor the Massachusetts system of mandatory premium-based insurance? Wouldn't it reduce the amount of bureaucracy and overhead if the system were tax-based?
Well, the short answer is yes, and we know that. In Massachusetts, my understanding is that what they've done is they've essentially required people to buy health insurance, which is kind of an interesting thing to try to do. I mean, if people don't have the money, they're not going to be able to go out and buy it, and then if you don't buy it, you get fined. I mean, they've built basically what they've built is another bureaucracy to try to force people to buy health insurance, which is really good if you're an insurance company, because it's like forcing people to buy your product. So that's number one, is it funnels more money to those private insurance companies that are already making a lot of money. It also develops a bureaucracy and a series of penalties for people who don't cooperate. And it's interesting, because when you talk about a publicly funded system, one of the things people are afraid of is a bureaucracy. Well, if you've ever looked at the Vermont healthcare programs that we now have, meaning VHAP and VScript and Catamount and Dr. Dinosaur, I have back in my office a 3-page sort of a breakdown of these different programs. Very bureaucratic, very complicated, frankly ridiculous in a lot of ways. So we've created this bureaucracy by having this patchwork of programs, which creates a lot of redundancies. It uses a lot of tax dollars, and it doesn't necessarily work. We have more uninsured people as ever. We have 60,000 Vermonters who are uninsured. So we do know that what we're doing is not working. We do know that what we're doing is resulting in ever-increasing costs. We do know that what we're doing creates a big bureaucracy, which makes it difficult for people to get the care they need. We also know that we wouldn't do the state police or the fire department that way. You wouldn't do your schools that way. I mean, if in fact healthcare is something that we believe, as I do, is a necessary part of our community, just like the state police are, or the local police, or the road crew, we have to find a way to pay for it together to make sure it's there when we need it. See, some people say, well, I don't use the healthcare system. Well, when you get sick, or when you get hit by a car, or you fall off your bicycle, you use the healthcare system. So you want the hospitals to be there, you want the providers to be there when you need them, just like you want the fire department to be there when you need it. So let's create a system that allows us to do that. Now, you would have to pay for it through some kind of broad-based tax. Now, keep in mind, we already are paying for most of our health care in that way already. 65% or so of our health care is paid for through public means, which is another way of saying taxes, public dollars. My question to Vermonters is this. Do you want to call it a tax? Do you want to call it a premium? Do you want to call it a fee? I don't care what you call it. The question is, do you want it to be less? I mean, at home, we'll get our letter from the insurance company. This year, your rates are going up, 10% or 15%. Not a lot of public participation in that. And nobody to complain to. There's no legislator to call. There's no town meeting day vote. My cost just went up, and that's that end of story. You either pay it or you go without it. I think that what we understand is that we want it to be lower. So we could say to each other, we're going to have this kind of system, and we're all going to pay premiums based on our ability. We could say we're all going to pay a fee for our health insurance based on our ability. We could say we're going to pay a tax based on our ability. I think we have to get away from the fear of using certain words, because if I'm paying a premium of $1,000 a month, or I'm going to pay a tax that's going to be only, let's say, whatever, $700 a month or $500 a month, which would I prefer? Well, I want the premium because I don't want to pay it as a tax, so I'm willing to pay, a third more or half more. I don't care what we call it, premium, tax, fee. I just want it to be lower, because that's what we need to do, is we need to lower the cost for businesses and families. So, I mean, quite honestly, exactly how we would pay for it, that's, again, a discussion we have to have. I don't claim to know the answer, But I do know that what we're doing right now is a big wreck. It's a mistake. It's doing all the things we say we don't want to do. It's driving up costs. It's creating bureaucracy. It's using tax dollars, and it's keeping people from getting the health care they need. So I would much prefer to us to agree that health care is something that, it's essentially a right. It's something we all need. It needs to be there for all of us. And in order to make that the case, we have to find a way where we all pay for it. Right now, we are all paying for everyone's health care. When that person we don't know gets cancer, or that person that we don't know gets hit by a car or falls off their bike, they go to the hospital, and those of us with insurance are paying for that person's health care. We're just not doing it in a systematic way that makes any sense. And we're not doing anything to have that other person, the one who got injured, pay as well. I don't think they should be required to buy health insurance from a private company any more than they should be required to send a monthly check to the state police. We should have a system that involves all of us and allows us all to get what we need in a timely, organized way.
I lived in Sweden for about a year, and they pay slightly higher taxes than we do, but they're very happy paying the higher taxes because they're saving the money, and they get a lot for their tax money. They get free education, free health care for everybody, and as you say, we pay. Some of us pay premiums for our health insurance, and if we have the health insurance paid for with the taxes, then we don't have to pay the premium. So we end up actually saving money by paying a little more in tax.
So my question would be, which is less? Really. That's what it's interesting because there are just certain things in Vermont that we're, not just in Vermont, but that we've been afraid to talk about lately. And I think we do need to get beyond that. And when it's interesting when you talk about taxes, and I'm not advocating raising taxes. I mean, if there's a way of using public money to reduce health care premiums, substituting one for the other, I'm not moving away from that. I think we need to look into that. But in general, it's interesting that how best to put this? We talk about not wanting to pay taxes, and frankly, none of us want to pay taxes. Don't get me wrong. I mean, I'm all for not having to pay more taxes. Who would disagree with that? But what's missing from the conversation is what do we get for what we pay for? It comes up around schools as well as health care. People say, well, it's going up, or it's costing a lot, or it costs me too much. And I'm sympathetic to that because people's wages are not going up. When you talk about taxes, let's talk about the cost of living. What's going up more, your property tax or the price of gas? What's going up more, your taxes or the cost of home heating oil? What's going up more, your taxes or the cost of health care? And again, I'm not advocating higher taxes. I'm just saying it's an interesting, we should look at it that way and see where we should put our energy. Should we be focusing on cutting taxes or keeping taxes reasonable? Sure. But why aren't we also focusing on doing something about the price of gas and the price of health insurance premiums or the price of home heating fuel or the cost of college? People get angry about taxes when they don't have when they feel like they're being overtaxed relative to what they get, what their income is. So you have to have that conversation that balances it all out. And let's talk about what we get for what we pay. I mean, I think most Vermonters want to have a clean environment, and they're willing to help chip in to do that. I think, most Vermonters clearly want good schools, and we have very good schools. But most Vermonters are willing to chip in to do that. Just to mention schools for a minute, because one of the things that I think happens too often in Vermont is people are, meaning our leaders in Montpelier, they're not really taken on let me say our governor, for best example. Our current governor spends a lot of time, attacking public education and talking about the cost of public education, but really doesn't talk too much about the fact that we have really good public schools. And I think rather than attacking those schools, which are so important to our economy and to our communities, I mean, our public schools are the center of most communities. They're where our kids go to learn to be a part of our community, our democracy. Let's not be attacking public schools. Let's attack the things that undermine public education, like high health care costs or energy costs, or this idea of making local school boards or citizens vote twice on their school budgets. I mean, this mandate to vote twice, no child left behind. Our schools are under a lot of pressure. And we're frustrated with high gas taxes. We're frustrated with the cost of health care. We're frustrated because we're losing jobs. We're frustrated because of a lack of affordable housing. So what happens is on town meeting day and every day we complain about the cost of our schools. Let's attack some of these other problems and stop attacking public education, because if housing is not affordable and the price of gas is going through the roof, attacking public schools doesn't solve those problems. Let's deal with those things, and let's not be afraid to have the conversation about not only what are we paying, but what do we get for what we pay. We have great public schools in Vermont, and we should appreciate that. Didn't mean to go off on that tangent, but...